All right, welcome. Today's presentation, we're going to talk about the four essentials of psychiatric diagnosis. My name is Dr. Daniel Martinez, and I've been practicing for over 10 years. In the 10 years, I have found that there are four things that I always need to consider before I consider a psychiatric diagnosis. The first thing is you need to rule out general medical conditions. We have to make sure that as we're considering a psychiatric condition, that the person may not have a tumor or may not have anemia or other things like problems with their thyroid. I just saw a person the other day with Wilson's hypothyroiditis, and so these issues are very important to considering psychiatric diagnosis, and that these are rule-outs. The second thing is you have to rule out that the person is not high on drugs or alcohol, and so doing a urine toxicology screen is essential to considering a psychiatric diagnosis. If a person comes into the emergency room high on cocaine, you do not know if the hallucinations that the person is experiencing may be due to true schizophrenia or due to intoxication on an illicit substance. The third thing is that you need to make sure that the person has sufficient amount of impairment. Oftentimes I get asked, when does a person's emotional problems reach to the point that they need clinical attention? And since we all may be depressed, we all may get anxious, we all may feel like we could hear things without anything being there, we need clinical attention or formal psychiatric services when those problems don't allow us to live the kind of life that we should be living. So there needs to be a significant amount of impairment, and impairment, I've oftentimes said, it's cultural, and so what might be considered impairment in one community may not actually be impairment in another community. The fourth thing that I always talk about as being essential to a psychiatric diagnosis is make sure that you know the DSM-4 TR fully. I know that the DSM-5 is going to be coming out shortly, and so make sure that you're up and looking out for that if you want to consider psychiatric diagnoses. Among the things are other rule-outs, making sure that the person meets all criteria, and then one very important thing, and oftentimes does get left out, is the time and the duration of a condition. And so we need 2 weeks of depressive symptoms before we can even consider a major depressive disorder. We need 2 years of depressive symptoms before we can even consider dysthymic disorder. We need 6 months of anxiety symptoms before we can consider an anxiety disorder. And so on and on, there are time criteria that are essential in meeting a psychiatric practice or a psychiatric diagnosis. Thank you very much.